Well, I think that the global pandemic of COVID-19 has pushed us to adapt and to adopt new strategies to reach out to our patients. And across the board, we're seeing that many physicians and many clinics are using telemedicine to reach out to their patients. Uh, there's always this concern, particularly in older patients, that they are not as technologically savvy, so they will have problems using this technology or interacting with physicians through mobile technology or through the internet or video conferencing. And actually, there have been some publications recently. There's one publication in the Journal of Geriatric Oncology this month from the group at the University of Rochester, telling us how to adapt a geriatric oncology clinic or a clinic specifically for older adults with cancer to provide not only care, but also more specialized assessments, the thing known as the geriatric assessment, which is an assessment of various domains that are important for older adults, how to actually adapt and do this through telemedicine. And so this is a feasible thing. And I think that this is something that is being used globally. We have also recently published with the group of the International Society of Geriatric Oncology the experiences of various clinics around the world, in Europe, in Asia, and in America. And everyone is using remote technology in a way or another to reach out to patients. Even in the United States, the regulations about the use of mobile technology and of internet technology to reach out to patients have been relaxed. So now you don't need to use this specific medical software to reach out to patients. You can use more freeware software, etc. I personally, in my clinic, I mostly treat older patients with cancer who are from disadvantaged populations. So these are people who are uninsured. Most of them do not have an internet connection. And so what I've been doing is using chat software, specifically WhatsApp, which is very used in Mexico and across the developing world. And I'm reaching patients through their mobile phones using WhatsApp video chat. And this can allow you to reach out to patients to do a lot of things and check a lot of symptoms. Of course, this has limitations, but it's a way to bridge these differences and to have patients get their clinic visits during these times of the pandemic. I think that another very interesting aspect will be the use of mobile apps. Like some countries are already using this to track patients and to track contacts with COVID-19. It's all over the news, you can read about it. But for cancer care in particular, I think that this will move us closer to getting a patient-specific outcomes that can be obtained through the remote sensors in various devices. So we could be tracking the patient's physical activity, we could be tracking some symptoms through patient-reported outcomes, and we could be even tracking other more sophisticated things, like using the gyroscopes and the accelerometers in the phones to see if our patients are falling, using other sensors to see if the patients are losing weight, etc. No? So I think that this will precipitate a change, moving more towards this connected medical home in which the patients can produce a lot of data and send it to their oncologist using remote technology. So I think this is a catalyst for change in this way. Yes, so I think this crisis has led to a widening of disparities. We're beginning to see some data, particularly from the US, showing that disadvantaged populations, ethnic and racially disadvantaged populations, are being hit the hardest by coronavirus. We already know that these populations are hit the hardest by cancer too. So limitations in access, problems with financial issues, I think they're gonna affect these populations the most all across the world. In the developing world, access to cancer care was limited before the pandemic, and now that many clinics are closing or that many hospitals have reduced capacity, this will certainly affect those that have less money and less access the most. And I think that this will continue for at least some time. I think disparities are going to be widened by the pandemic initially, but that this, I hope, this is more a hope than anything, but I believe that in the future, the effects of the pandemic will lead to systemic changes that will actually end up shortening those disparities or making access better. I think what we are seeing is that all healthcare systems are poorly prepared to face something like this. and that we need to strengthen these systems and make sure that access is guaranteed for everyone. I think that access is the key for providing better cancer care. It's the first step. It's more important than everything we do after. If we have the best treatments but patients cannot access them, then what's the use of these things? No? So we're seeing it now, and we'll see it in the future, but I think eventually this will lead to a systematic change. And I think that we as oncologists have to be prepared for the backlash after the worst part of the pandemic is over, because we're gonna see more patients with more advanced disease. We're gonna see worse outcomes in patients from disadvantaged populations, and we have to make sure that our healthcare system is prepared to face this incoming challenge.